Palliative care is about addressing all of the needs that someone has, the social needs, the psychological needs, the spiritual needs, in order to try as best we can to relieve some of the suffering that people go through when they have a serious illness.
To palliate is to alleviate symptoms, to try to alleviate suffering, right? So palliative medicine tries to address the symptoms, the discomfort a patient experiences through managing pain and other symptoms they may have, by addressing any psychological, emotional distress, and also spiritual distress. And that's why for palliative care, usually it's delivered by a team. You don't have to be at the end of life to receive palliative care. So patients can be of any age. People can be receiving curative treatment even for their care, and receiving palliative care, this extra layer of support. So if someone is admitted into the hospital, they can request for palliative care, just like a patient can ask to see a cardiologist or to see a kidney specialist. And many of the hospitals have this service across the United States. There are organizations that provide palliative care in the home setting as well. Now, when patients are at their end of life, of on average 6 months of prognosis, if the illness goes its natural course, then the patient can receive this benefit of hospice care. When patients are receiving hospice care, which is 安宁疗护, they will continue to receive treatments to manage their pain, manage their nausea, vomiting, their constipation. So any symptoms that's causing discomfort, they will continue to be treated.
我们通常就是在关注病人的和家人的一些情感和灵性上的一些需要，包括有宗教信仰的和没有宗教信仰的，甚至是无神论的。我们是叫做 interfaith chaplain。我们关怀每一个病人，不管他的背景，不管他的种族，不管他的文化是怎么样，以至于我们的病人可以在最后的阶段呢走得比较舒服，比较得到安慰，家人呢也得到相应的照顾和鼓励，还有陪伴。
When you're working with someone who is at the end of life, you know, whether it's 6 months or 6 weeks or 6 days, that when you're with that person, what's important is that you be loving, you be caring, and that also when you leave, you say a proper goodbye so that you don't have regrets after a person dies.
我作为一位聆听者，看一下他们需要的是什么。那如果他们需要的，而且我可以帮助的，那我就会帮他们去找资源。那如果他们不愿意談或者也不知道的，我就會用美華慈心的資料，進而讓他們了解更多這一方面的知識。
我自己覺得自己嘅工作咧好有意義。嗰段路可能係佢喺人生裏面比較困難嘅。我帶住一個咁嘅角色，好似一個第三者，又係一個同行者。並且如果佢哋有一啲迷茫嘅時候，咁可能喺我哋工作上面就係俾一啲指引啦，或者陪佢哋走過呢啲困難嘅時刻咯。
So sometimes physical pain may be the most important thing that has to be dealt with before anything else. But sometimes it's psychological pain that has to be dealt with most importantly in order for that person to relax and calm down.
作为社工、精神辅导的、灵性辅导的，我们很多的时候，我们是 focus on 家人的，还有他们的孩子，他们的亲戚，很多在病人身边的这些人，他们的 caregiver focus on 家人比 focus on 病人还要多很多。自己亲爱的人就要走了，每一个家人都会非常多的压力，照顾的压力，情绪的压力，休息啊，或者是沟通的压力都非常多。这些家人真的是非常需要一些灵性关怀的辅导师和他们聊一聊，以至于他们能够平安的陪伴他们的所爱的家人，然后呢也能够好好的照顾他们自己。
Another major difference with hospice care is people who enroll in hospice have made a decision that they forego active treatments that's trying to cure or prolong their life. so that there's a shift in the focus of care from attempting to prolong to really focusing on comfort. And I think what people don't know many times is that actually when people start hospice sooner, studies have shown they live longer.
我们相信病人就算走了，他的听觉仍然在的，他会听到家人的说话，他没有办法去 respond 去回应，但是呢，他会听得到的。所以我们会在他的床边鼓励家人说一说他们的感受。我们很多的时候会对着病人说：“你放心，我们都在这里，你的家人、女儿全部都在这里，我们在你身边，我们都很好。你要是想走，可以放心的去走。目标就是就是尽量的保证病人疼痛减少，症状呢得到舒缓，然后呢。”平安的走。
美华慈心呢跟 El Camino 医院呢合作，培训一些合格的志工，在 El Camino 医院里面服务华人去探访住院病人。